Uganda hosts over 1.4 million refugees. The biggest number of these are in the West Nile region in the districts of Arua, Yumbe, Moyo and Adjumani, among others. These districts border the Democratic Republic of Congo and South Sudan, respectively. In President Museveni's most recent address, where he announced a partial lifting of the lockdown, including the movement of private cars, he warned that for border districts, the ban will remain as they are hotspots for infection. By Kania Armitage, the Mvepi settlement commandant says movements in the settlement are not restricted, which goes against the social distancing directive. He adds that there are refugees who cross into South Sudan and sneak in other people. This puts people at risk of COVID-19 infection.
But we are working through the district, the police, internal security, and even the refugee welfare systems to report those new people who might have come in unknowingly.
This is not different in Adjumani, where 3 recent cases have been registered.
The people from South Sudan have been told that if you want health, run to Uganda. So they come through River Onyama, enter through Amuru district, and then penetrate Adjumani.
In January, NTV ran a story about refugee children spending their free time in the child-friendly spaces as a therapy to heal from memories of the war. These spaces have since been closed because of COVID-19. The settlement commandant believes this could cause disruption in families.
Children at will also moving up and down, so they are also we have also cases of child protection coming up.
In Adjumani district, a number of children have already fallen victims of violence.
We have 3 girls who have been impregnated. We have some young children who have been molested by people, but the police are taking key responsibility.
The resident district commissioner says the situation could escalate as they do not have enough equipment to handle the increasing number of those under quarantine.
The isolation unit has only 4 beds, and these 4 beds, if they are filled up, will have a challenge. The other places that we think would make us isolation points have still some challenges of power, water, and fencing.
He says there is little food compared to the number of those in quarantine.
Unfortunately, the first food that came, what is packed is not what is actually in the containers. What they pack as 5 kilos is actually 3 kilos. And what is 3 kilos is 2 kilos. So I think there is a need for proper packaging.
While handing over PPE equipment to the border districts of Arua, Moyo and Adjumani, the Minister of State for Primary Health Care, Dr. Joyce Moriku Kaduchu, said that with the continuous community cases, the ministry might consider new ways of quarantining people.
It is time for us to see beyond institutional quarantine. The rate at which the transmission will occur, we need to look at geographical quarantine such that we self-isolate individuals within their village. They are surveyed within their village. If not, I don't think we'll be in position to feed all those magnitude of people. We'll not be in position to cater for everybody to be isolated.
Charles Owekmeno says there is need to double awareness and sensitization in the refugee settlements to make them understand why they need to stay safe from the virus.
Much as a lot of efforts have been put in COVID-19 response, limited has reached out to the refugees. There is preventive efforts towards making sure that the refugee settlements don't get the risk of contracting COVID-19. But inside the refugee settlements, the lifestyles have not changed. Meaning that if we get a risk of a single infection, we will be able to get very high number of people infected within the settlements.
Focus on prevention, and especially in this area, because there are so many refugees, but also so many host communities here who are potentially at risk for the COVID-19 infection and virus. So we really need to be here for the prevention of that.
The donated equipment is meant to aid the medical officers provide the necessary services as they observe their own safety. Olivia Komgisha, NTV News.